Hello, everyone. Welcome to episode 5 of Health Horizons, where we explore public wellness. My name's Kara Showers, and I am the Prevention and Wellness Coordinator for the Melrose Health and Human Services Department. I received a Master's in Public Health many moons ago from Boston University, and I'm also a certified health education specialist. So I'm so excited to chat today about lung cancer awareness. And I have two amazing guests, Melanie Steeves with the Mass Comprehensive Cancer Coalition, and Maureen Busby, our HHS Regional Tobacco Prevention Coordinator and my office mate for many, maybe more years than we'd like to admit.
For sure.
Thank you guys so much for joining us.
Yeah, so happy to be here.
And thanks for having us, Kara.
So to set the stage for today's conversation, I just want to highlight a few things that both the CDC, the Centers for Disease Control and Prevention, and public health research tell us about lung cancer. So the first thing is that smoking continues to be the leading cause of preventable death in the U.S. More people in the U.S. die from lung cancer than any other type of cancer. And protecting our lung health and learning how to lower our lung cancer risk is important for everyone. So the best ways to help prevent lung cancer are, 1, to not smoke or quit if you do. 2, to stay away from secondhand smoke. Thirdly, you can lower your risk of lung cancer by getting your home tested for radon, which is a natural gas from the ground that can get trapped in homes and buildings. If you test and you find that radon levels are high, we want to take action to reduce the radon coming into your home or building. Another thing the public health research tells us is that finding lung cancers early and better treatments are helping people with lung cancer live longer. Lung cancer screening is recommended for adults who are at high risk for developing the disease because of their smoking history and their age. So what can we do? There are 3 things I'm going to suggest. The first is to talk with your doctor about your risks and find out if screening is right for you. We'll cue this on at the end of the podcast, but the American Lung Association has a helpline, and the number is 1-844 ALA lung, Lung. So that's the first thing that we can do. The second thing is to get your home tested for radon, like we alluded to earlier. You can call the Mass Department of Public Health Radon Info line, and that's at 1-800-723-6695. The third thing we can do is we can reduce cancer incidence by promoting a healthier environment for young people and reducing the prevalence of tobacco and nicotine addiction in our communities. So now that the groundwork is laid, I want the audience to learn more about the state's Massachusetts Comprehensive Cancer Coalition, which Melanie will talk about, and then also about the tobacco prevention work that's happening here locally, which Maureen will talk about after. So turning it over to Melanie.
Awesome. Thank you so much, Kara, again for having us. I'm really excited to be here. So as you may know, cancer is the number 1 cause of death in Massachusetts. The Massachusetts Comprehensive Cancer Coalition, or MCCC, is a statewide coalition of individuals and organizations working to significantly reduce the burden of cancer for all residents of Massachusetts. Our mission is to develop partnerships that address the disparities along the cancer continuum and improve the lives of cancer survivors and those living with cancer. To further this mission, the coalition brings together partners and collaborators to understand the issues through data and lived experience, to strategize potential solutions, and to harness collective impact for cancer control and prevention across Massachusetts. The MCCC is made up of patients, survivors, and caregivers, clinical care providers, municipalities like Kara, community organizations, cancer centers, community health centers, academic partners, advocacy groups, and others working across the cancer continuum from primary prevention of cancer, for example, through tobacco prevention and radon awareness and mitigation activities that Kara mentioned earlier, all the way through survivorship and end-of-life care. In addition to the work around primary prevention that the coalition does, our secondary prevention health equity committee focuses on strategies and activities related to the screenable cancers. Lung cancer has emerged as a top priority for this group. And while the lung cancer screening rate in Massachusetts is one of the highest in the nation, the number of eligible folks who receive annual screenings remains quite low. By educating people in Massachusetts about lung cancer screening and encouraging screening uptake if they are eligible, the MCCC aims to help to get folks to treatment earlier when there are more treatment options available and better possible outcomes. And now I'll pass it over to Maureen.
Thanks, Melanie. That was great to hear. I learned something already that I didn't know, and I want to talk to you offline. As Kara said, several local boards of health have adopted a new tobacco sales regulation called nicotine-free generation. This is an important regulation that further restricts nicotine sales to young people. Melrose has long been a leader in tobacco control. We were early adopters of T21, pharmacy bans, cigar minimum price, flavor restriction, permit cap, and other policies, some of which have since become state law. And that is the goal for this policy as well. Get enough cities and towns to adopt the policy, and then the state legislature is more apt to take action on a statewide bill. NFG is actually a brilliant policy, the design of which changes tobacco sales from an age-restricted product to a birth date-restricted product. In Melrose and several surrounding towns, as of January 1st, 2025, no one born on or after 1/1/25 will be able to purchase nicotine products in Melrose and those other communities that have adopted this policy. It's a slow rollout that allows retailers time to adjust to slightly lower tobacco sales over an extended period of time, unlike the flavor ban that we did a few years ago, which removed products from store shelves on day one. Each year, just 1 year's worth of potential new buyers will not be able to legally buy tobacco products. No one, however, gets a privilege taken away. Those who are already of legal age to buy will still be able to purchase and consume these products. This policy is easy to administer. The sales clerk just has to look at the birth date on the ID. Either the purchaser was born before the cutoff date and can be sold a tobacco product, or they were born on or after the cutoff date and can't. The highest court in Massachusetts has decided the legality of this policy. Should there be a legal challenge, we don't expect one, Northeastern University's Public Health Advocacy Institute will defend any municipality pro bono, as they did in Brookline. When Brookline was sued back a few years ago, Brookline happened to be the first city or town in the world to adopt this type of policy. But doing this policy helps us move finally towards a nicotine-free generation, saving lives and billions of dollars in healthcare costs. I'd like to share a couple of quotes that resonated with me as I've been doing this work over these past several months. A longtime board chair, who was not always a fan of tobacco regulation, said, "We do it for the kids." And that's the key. This is not about adult smokers. This is about protecting future generations from the financial, health, and opportunity costs of a lifetime of addiction. We know nicotine addiction can be a gateway for other substance use. Adolescents whose brains are not fully developed until about age 25 or 26 are especially susceptible to addiction. Almost no one becomes addicted to nicotine as an adult. In fact, 80% of smokers started while still teenagers. And our youth want it. Youth show up for public hearings. They speak up at these hearings. This is for them and about them, and they want to have a voice. In fact, another quote came from a 16-year-old Natick High School sophomore just this past weekend. She asked me why anybody would object to this policy. So I explained that some of the pushback we hear, for example, is that we're taking away someone's rights. She said, "Taking away the right to sell a poison?" This is a young person so alarmed by the number of her peers who use nicotine products that she has filed her own bill in the State House to ban internet sales of tobacco products. She's very interested in working on our NFG bill as well as on her own internet sales ban bill. She told me, "We have to do everything we can to fight big tobacco." And she's right. We talked about lung disease being a leading cause of death here in Massachusetts, and smoking overall is the leading cause of death in this nation and around the world. We need to do more, and we can do more. And I'm especially grateful for Kara for this opportunity to share these comments, observations with all of you today, and especially to share the platform with Melanie. Thanks, Kara.
Thank you so much. Wow, I learned a lot too, we work with you every day, Maureen, and I'm working with Melanie in the MCCC. So great information that you guys were able to provide. Really appreciate it, and I know we will put resources and contact information part of the YouTube link and through MMTV, so folks can go there to learn more. So thank you so much. Thank you both for being here and for MMTV bringing this all together for us. And until next time, take care, everyone.